Thank you so much for joining us.
Oh, hi. Yeah, my pleasure.
I'm going to introduce Fran and then we will get to the questions. So Fran Gilmore was a high school biology teacher in the Boston area in the 1970s before she went to graduate school to study industrial hygiene and workplace health and safety. She became an industrial hygienist in 1980 and worked for a national union, then the New Jersey Department of Health. More recently, long after retirement, Fran joined the People's CDC to help to develop accurate information designed to counter the misinformation on COVID produced by the CDC. For the People's CDC, she's produced info sheets on school ventilation and workplace ventilation, both focused on protecting against airborne COVID virus. She also produced materials on respiratory protection for COVID. And last year, she was kind enough to do an amazing presentation for our 2022 Back to School Conference. So we are so excited to have you back, Fran.
Thank you. I'm delighted to be here. Yeah. And that presentation is still on YouTube.
Yes, it is. And we will send links out to that as well. Okay.
It's the only thing I ever did on YouTube. So if you just put my name in, that's what comes in.
And if you have any questions for Fran regarding ventilation in schools, please put them in the chat. We already have some questions that we received from the community ahead of time. So if there's, is there anything you want to say before we got started with the questions, Fran?
Not really. I did prepare answers for the questions that were by the community, but if there's any others, I'm happy to say what I know if I know anything.
All right. So, and if you want to, I'll have to ask Megan if she'll give you control of the screen. I didn't know, did you have slides you might want to share?
At one point, yes.
Okay. So you just let us know and she'll share the screen with you or give you the power to share.
I think she should be able to, so.
Okay.
Let me just see if I can. Yep. I'll do it later.
Okay. All right. So the first question is from a parent that says they desperately want mitigations for their child's school, but their school says it's not necessary unless it's a fire safety issue. What advice do you have to share with them, or what can they do?
Well, my first thought when you say that is that it's much more of a issue of campaigning, of winning a fight for it, than it is a technical issue. And in the middle of the fight, you want to educate yourself and educate your community. But building the campaign is the really essential thing. I suspect that the school, when they say they can only mitigate fire safety issues, I suspect that they just don't want to do ventilation issues because they're expensive, and that they know better. But there's always the possibility that they're ignorant. That's really hard to believe because this stuff is out there now. But if they're ignorant, then your job is to educate them. But if they're informed, your job is to put pressure on them. And that means gathering together your allies, which would include the stakeholders, the parents, the teachers, other people in the community, because if COVID is spreading through the school, that's going to invite spreading into the community and into the families of the kids and then the community and so on. So it does affect the whole community. Right. Possibly local public health officials and maybe others you can think of who would have an interest in this, but those would be the main players. Educating yourselves and them involves finding information in ordinary people's lay language, such as fact sheets and articles. And I've provided a whole lot in a resource list I put together this morning, which I hope is helpful. And I recommend contacting some people in Boston who formed a coalition that had remarkable success. They actually succeeded in getting HEPA filtered units in every classroom in Boston. Wow. Which is because the Boston schools don't have any ventilation systems. So that was really, as most schools don't. So that was really the best option, and they did, plus a big amount of money. Masking was required for a while, and testing was done. So the slides I want to show you are about that coalition and
Right.
what they did to organize, because organizing isn't usually what we talk about in an industrial hygiene presentation, but organizing is what makes it possible to use the information to win a fight. And it's always a fight to get improvements in the safety and health of any workplace, including schools. So let me,
know.
wait a sec.
Here.
I'll go back because I don't seem to have open the thing that I want to share. I do, but it didn't show up on the screen. Okay, let me try that. Huh. Oh, here it is. Okay, so this was a presentation that I gave for something called NCOSH, which is National Coalition on Occupational Safety and Health, last December. And it's very similar to the presentation. I started with the one that I gave this group last year, the one that's on YouTube. So it's similar, it's bilingual, English and Spanish, which may be of use. And I'm starting at slide 34 and doing about 8 slides, which address this coalition in Boston that really carried on a remarkable fight. And you can see up here, the coalition is a group called Famcosa, which was Families for COVID Safety, which was really mothers and grandmothers of kids in the schools mostly. And then they united with teachers. So the
Fran,
yeah.
Can I ask? So somebody in the audience was asking, are you able to make that into the present mode so that they can read along with you?
Oh,
so
I'm not sure.
Usually it's
slideshow.
I think it's slide then view, like you click slide up at the top.
There
you go. You got it.
Slideshow. Okay, thank you. I learned something. I'm not a tech genius. Wrong generation. Okay, so here's the coalition. Let's see. Famcosa, NCOSH, which is Massachusetts Coalition on Safety and Health, which has been around for decades, organization of unions and industrial hygienists and health and safety people and community people and so on, who have been very effective at fighting for health and safety in schools and in many other workplaces. Okay, I'm just going to read the English. I did not do the translation. So the schools are very much non-white. 84% of the students are of color, and it's also 70% are low income. There's many English language learners and students with disability, and the buildings, I understand, are the oldest school system in the country, it being Boston. It's, one of the first cities ever there. And I thought it was all of them. 3/4 of them lack a ventilation system, HVAC, heating, ventilation, and air conditioning. That's a ventilation system. So that's a little view of who they are organizing. These are the things that they have won to date. In the 2020-21 school year, they got HEPA air cleaners. Everybody knows what HEPA means, I assume, but if you don't, it's high efficiency particulate air, which is the best air cleaners that remove almost 100%, 99.5 or whatever % of the tiniest particles. So that would include droplets containing COVID, tiny, tiny, tiny ones. So that's what's recommended for COVID and any other very small aerosols. And of course, anything larger, they would remove too. So they won HEPA air cleaners for every classroom in the school, which I find phenomenal. $3 million added in the budget for COVID safety that year, same year. The Boston Public Schools, that's BPS, mask requirement for 15 weeks longer than other school systems. Oops. Vaccine clinics sponsored by the Boston Public Schools and the Boston Public Health Commission with gift card incentives and so on. So these are some huge wins. Okay, so this is what we really want to look at, how they did it. Okay, the first thing was to gather allies to form a coalition. And those included, who you see listed, students and families, the teachers union, including nurses and paraprofessionals, health professionals, especially doctors. And of course, Boston is the home of Harvard Medical School and a whole bunch of teaching hospitals. I mean, there's an enormous health community in Boston, probably the biggest in the country, which not every city has, but you still have health departments and you still have doctors among whom you can find some interested. Boston was just kind of a gold mine for that. And various education and advocacy community organizations. So that's the first key, is figure out who your allies are and organize them into a coalition. It's a big job. The main elements of the strategy, they wanted to engage the most impacted families, especially families of color and limited English-speaking families, because they're, of course, the ones who often get left behind. They wanted to leverage power by building coalitions, which is what I've been saying. And they said they wanted to keep equity at the center, which really meant the leadership included the people they were trying to engage. They wanted a multiracial, multi-ethnic, multilingual organization and the people in these marginalized communities with leadership roles. And continuing, they were persistent and relentless with policymakers. I mean, you all know, if you've ever been involved in any fight or you read about them all the time in the papers, they usually take a long time. The women's suffrage movement took about 90 years. I hope this doesn't. But a fight takes a long time to build and to carry out, and especially if you're asking for something expensive, like good ventilations or a HEPA filter is anywhere up to $500 a piece for the biggest ones. And if you're asking for thousands of them, you're asking for millions of dollars of expense. So you can expect a lot of pushback.
Yeah.
Okay, then they paid attention to the relationships among their leaders. So they were building trusting and caring relationships, supporting each other, personally checking in. And they also, I keep trying to scroll down on the slide and you can't do that. Scroll down to the next slide. And building leaders, was really important that they educated themselves and each other as they went along. And one of the things, like Famcosa was mostly made up of grandparents, but NCOSH is made up of technical people, a lot of them, as well as community people. So that's why it's such a good coalition to have technical people who are there as community advocates along with the community, so they can help provide the educational component and get everybody educated, so that the community people become leaders and become more expert. So I can hardly read up the slide. I can't read the right half of the slide because of.
Do you want me to read this?
I got it now. I had to push the bit of screen with our pictures on it aside. So Famcosa develops our analysis and demands collectively, drawing on the lived experience of Boston public school families, especially the marginalized one, BIPOC immigrants, limited English speakers, students with special needs. We also have members with expertise in public health, ventilation, and research, and that's, of course, NCOSH. And are there people who are going to be seeing this stuff all over the country, or are they in the Philadelphia region, or what?
It's a national presentation.
Okay, because every city will have a little bit of different stuff. There are COSH groups all over the country, and I should also say NCOSH, the National Coalition on Occupational Safety and Health. is really the resource to give people nationally to go to, because they have a whole list of industrial hygienists and other technical folks all over the country. So that's where you go if you want to find people to help you, to come and educate you, to speak, to send you resources and so on, is NCOSH. Okay. NCOSH. So these are some of the specific tactics they did once they got this coalition organized. They had a press conference. This was all in, I think, 2021. Press conference the first day of school. Okay, so there they are, a mob of people, multi-ethnic, multiracial, out in front of the school, talking to the press. They testified at the school committee and at a city and state hearing. They gathered data from families. They did that using a cafeteria survey. So anybody who worked in the school, parents, PTA, or whatever, who was able to, could go in the cafeteria and pass out surveys. So it's a really good way to access students, teachers, staff. Then they had email campaigns and call-in campaigns, and they even had rallies, and they had a car caravan. So they did all of these, gathering people together, press conference, and direct action, as they say, things on the street.
Mm-hmm.
So all this stuff is important. And here's a thing about they had I don't know if you can read this up here, it says Schoolyard News. It appears to be I'm not sure what it is, if it's the Famcosa newsletter, but it's the Boston Public School newsletter. It's very, very local. And they show more than a dozen Boston organizations demand stronger COVID safety measures. And this, I believe, is their press conference in front of one of the schools. Continuing with the tactics, they did media stuff. They did op-eds in the press and social media. They produced educational materials. And again, that would probably be NCOSH and maybe the health department. And I'll tell you more about this later. They co-authored an article in the New England Journal of Medicine on masking. This was the most amazing thing. Yeah. And here's a clip from the article. Masks cut COVID spread in schools, study finds. And I'll tell you about that study later. It's really an incredible thing. And the basic message for you who want to get out information to the public, to the teachers and whatnot, in 2 words: masks work. Yeah. And this study proved it. We'll get to that. Oh, I'll tell you about it now because that's the end of those slides. Let me stop.
I've actually shared that study many times.
Okay.
Some school mask study that's been like a go-to source,
right?
For the mask naysayers.
Great, and if you want to add that to the resources, because what I put on the list, what I have was what ended up as a New York Times editorial describing the study, because it's more comprehensible. It's written it's written for educated but lay readers. And what happened was, in these struggles over COVID protections, the Boston Public Schools, there was a mask mandate in the whole state of Massachusetts, in all the schools for a while. But I think it was sometime around January 2022, or probably. I've forgotten the dates now, but the mask mandate statewide was dropped, but the Boston Public Schools, through this coalition, I believe, were able to win it. So they were wearing masks, and one other nearby town, which was also a working class town, very close to Boston, also had a mask mandate. And all the other schools in the Boston area, and I don't know if you know Boston, but it's divided into, there we go. Mask mandate 2022. Dropped February 2022. Okay.
Thank you, Jana.
March. Okay, so there was a period, and then the Boston Public Schools lost that fight, and so there was and had to drop the mask mandate. So there was a period of a couple of months where only these 2 school systems, Boston and one other, I've forgotten the name of it, whoever did that thing.
Chelsea,
thank you. Somebody here. Thank you, Jana. Okay, I read this a year ago, and I only had this invitation to speak this morning, so I haven't had time to review everything. Thank you very much. Anyway, so there was this period of 2 months where 2 towns, Boston and Chelsea, were wearing masks, and all the other towns in the area. And if you know the area, there's a million little towns. That's the way the whole thing is structured. Cambridge and Somerville and Malden, and just 100 little towns. So you can study all of them and get the figures from all of them. And what happened was, I thought I had that slide. Oh, I do. Wait a minute. It's a different place. It's slide 26. There was this period. Here it is. So 70 school districts dropped their mask mandates, and they had nearly 12,000 excess COVID cases, meaning a rate that much higher than Boston and Chelsea. Even though Boston and Chelsea were crowded and had no ventilation. I'm not sure if they had no ventilation at that point, if they didn't have their HEPA units. I'm not sure. But they certainly had no HVAC system. So there was a huge difference. It was like a natural experiment that occurred, and the Harvard School of Public Health jumped on it because they've been doing a lot of work on COVID. They put out a lot of good materials on COVID mitigation strategies, ventilation, and so on in buildings. And they saw, oh my God, here's a natural experiment, 2 schools with and 70 schools without for 15 weeks. Let's get the figures and study them. And they did. And the conclusion is very simple. Masks work.
That's pretty plain to see.
Yeah.
Amazing. So what occurs to me is that, and this leads into the second question, because right now we have a situation where people are either unaware or unconcerned with COVID case numbers, so they don't think that these measures are necessary any longer. So the second question was, where can we get reliable real-time information on the current wave? And what if my county is not part of the wastewater scan program? So if you want to go advocate in your school district, the absence of data can be a roadblock. Do you have any?
It is a huge roadblock, and there isn't a good answer for it, unfortunately. It is very hard to get real-time data now because there's very little testing going on. Right. CDC now, which used to report testing and community spread, I mean, they even dropped community spread a year ago because they were trying to create the impression a year ago that COVID was not serious anymore, when it was.
Right.
When, in the old community spread maps, I wish I had one in front of me to show you, but I don't, where red was the color of high community spread, about 80% of the country was at high levels. But they were showing another map in pastel colors, which was only hospitalizations. Mm-hmm. And most COVID doesn't end up in the hospital. So the map was like this pretty light green. The whole thing that was red in the community spread map was light green in the hospitalization map. And he said, see, there's hardly any COVID. And it was baloney.
It's also part of the campaign of only focusing on hospitalizations and deaths from COVID and kind of pushing the thought of long COVID or the concern about long COVID out of the public conversation.
Right. That's totally what it is. I mean, it's totally about getting people back to work, getting the economy going, and who cares who gets sick and dies. That's a basic message from CDC. I mean, they're even in the process of eliminating any requirements for hospitals to have universal masking. They're making it optional, and a lot of hospitals aren't doing it. And that means there's no safe place for people who are at high risk, immunocompromised, or just old to go for healthcare. It's horrible, and it's a big fight going on right now about that.
Absolutely.
The thing I can suggest is to go to the resources that are there about national trends and use that. Even if you don't have actual wastewater testing, you may not do any better than hospitalization. So you're not really going to have anything much to go on. But if you look at national trends and show, for example, wastewater is rising in all parts of the country. Mm-hmm. And wastewater is an indication of trends soon to come, because it's everybody poops, and it's looking at signs of COVID RNA in sewage. And when it rises, it always predicts that there's going to be more cases, even if we don't have any tests to show that the cases are there. But the
Right.
wastewater shows it's going to happen shortly. It's the best predictor that we have. So one place to find out about the national trends is the People CDC puts out usually a weekly thing called the Weather Report. And it will have discussion and maps, and some of it gets techie and I don't even understand it. There's some people who are really into being techie, but the basic information is there that you need. And I put that in the resource list, which I'll distribute. It's how to go to the People CDC website and get that. There are some other sources, and I put another one. It's called YLE, which stands for Your Local Epidemiologist. And it's a newsletter that's put out about weekly. I think she just announced today she's going to be bi-weekly. And it's not only about COVID, but there's been a lot of stuff on COVID. And it is a newsletter about trends in public health nationally, of which COVID is a strong one there. Her name, she has a great name, Caitlin Getolina. It's on the resource list. You can go to that, and I think I put down the link to the archive of it. No, that was for Weather Report. So link to the archive of Weather Reports. And there's a link to her, and you can subscribe. So with those two, and there might be other sources that I don't know about, but with those two sources, at least you can have national trends, which might include your region. That's probably the best you can do right now.
Right.
You can.
And we will share those sources. Fran put together a whole resource list with us, so we will get those out to everyone. We'll share them with the community.
Okay. And it was possible that your state or local health department has data, but my guess is it'll only be hospitalization data. But you can ask or go online and just look for it.
So what about measuring the air quality? Is that something that as citizen scientists, or that we should start taking on, measuring the air quality, so we have data to show the schools? And if we're gathering data, what is safe air quality versus entering a danger zone?
Yeah, you have to be a little bit specific about what you mean by air quality, because everybody wants good air quality, and it involves a few things. It involves temperature and humidity and contaminants. And most important, the amount of fresh air that's coming in to flush out contaminants, or filtration plus fresh air to flush out or capture contaminants. I just learned today, I was in touch with NCOSH today over this, and found out that they actually have a contract with a company that has an air quality measuring device that measures all of those things. I don't have details on it right now, and I can go back in the next few days and find out more about that and add it to the resource list. It's on a Google Doc, so if I add it.
Yeah.
Anyway, but there's one thing you can do that's relatively easy, but a little bit, it takes some awareness of detail, but it's to measure the carbon dioxide.
Okay.
And here's the deal. Carbon dioxide gets into the air when there's people in a room because we exhale it. And we're not measuring it because it in itself is harmful, though at high levels it is. And if you get up past about 1,000 parts per million, there's slight disagreement over it, but people often feel woozy and their concentration isn't so good. So it is not very great for a school environment or any work environment or any environment to have the CO2 at such a high level that people are feeling uncomfortable, or a little bit foggy in the mind. But we're not measuring it because of the harm of CO2. We're measuring it as a proxy for everything else that could build up in the air. Because if we have a CO2 monitor, and they're relatively cheap, you can get them for under $100 in the room, and somebody is checking it periodically, and you see that the CO2 is rising, that tells you that anything that's not being filtered is rising in the room, that there's not enough air exchange or fresh air coming in and contaminated air going out, or better yet, being filtered. I wrote a fact sheet on that too for People's CDC, and that is in the list, resources list. It's very important to read that. It's a few pages because it tells you several things you need to know, like how to conduct it really, like take a reading outside first to get kind of a background level, till you know, like, okay, CO2 in the outside air is somewhere in the 400 ppm range. Back when I was doing this in the beginning of my career, it was in the 250 range. But that's, yeah, it's getting worse and worse. So in the 400 range is quote unquote normal. Let's say average is not normal. And then you bring it into the classroom, possibly if you have the opportunity to bring it in early in the day, and then take readings every half hour, every hour, whatever you want over the course of the day, if you have the ability to do that. And then keep a chart of those readings. That's ideal because then you have a record of the rise over the course of a day in an occupied room, noting how many people are in the room at each time. Because if people go in and out, if the room empties out, the CO2 is going to go down. And that doesn't mean the air got better. It just means that people left. The other big, I'll just mention this one thing because it can be confusing. If you have HEPA air filters in there, the CO2 measurement doesn't really mean anything, because the HEPA air filter is going to capture the things you're concerned about if COVID is your issue. It's going to capture the COVID particles. It's not going to capture CO2. So you may have CO2 rising, but that doesn't say anything about COVID. COVID may be captured. So the CO2 monitor is useful when you don't have air filtration in the room.
And so that makes me wonder, so I guess by the same thinking, if you open the windows, if you're monitoring the air with the air monitor and you open up a door or a window, that's also going to not give you the CO2 levels.
Well, that's when you want to know what the CO2 levels are.
Okay, yeah.
Because you want to know, is the fresh air coming in enough to dilute anything in the room? And if the CO2 level rises and then levels off, that's good. Then it's good enough.
Okay.
But I guess you could say if you have particulate or HEPA filtration and you have open windows, you could measure it and see if the open windows are helping it. But it's not an index. It's not a proxy for COVID.
Okay.
Because the COVID's going to get filtered. You'd really have to you'd have to know the details of the HEPA filter unit, how many air changes, look at those things about it.
Okay.
And okay, that's all I'll say about it. Everything gets techy when you get to the weeds of it.
Yeah.
The concept is simple, but the carrying out is a little bit. You have to
okay, so the next question, this person mentioned that Illinois is providing schools and daycare centers with air purifiers. If transmission of COVID continues to rise, when will it be necessary to bring back masking in schools? So if the schools do have air purifiers, but COVID cases do surge, is there a point where there's only so much the air purifiers can do? We need the layered mitigations with masking.
Yeah, it's almost impossible to answer that question with numbers because we're not getting any help with regulation. We're getting the opposite. We're getting denial of the whole problem.
Right.
So the question asks if transmission continues to rise, and I'm not sure if the person who wrote that meant transmission in the community, in the nation, or in the schools.
Right.
And you would probably, there are different sources. You would know when it rises in the schools just from local information from people seeing kids out of school and stuff. And
maybe if absences are spiking, we know that COVID wastewater throughout the nation has shown that there's increased cases. And if there's a lot of student absences, like last year when we had the RSV, flu, COVID surges, is there a point where, I'm personally want masks in the schools, anytime COVID is a possibility, but is there a certain metric or a certain level that you feel like would be a warning sign or a measure that people could take to the schools to just advocate?
Not that I'm aware of. I mean, you'd almost have to set up your own. It would be basically the idea of rising. And somebody asked in the chat, I think, if school absences is public information. I don't know. I doubt it, but it might be.
Yeah, I don't think it is. I know in the first year or two of COVID, I know that our local school district, and I'm assuming a lot of others, were posting absences. Like ours was posting it weekly, and I know that that stopped after, I think, gosh, beginning of 2022. So yeah, that's true. That's a good point. Thank you. That we would probably not know those absence data in real time.
If you have a connection to the PTA or you are a student in the school, you might just know from the scuttlebutt in the school what's happening. People are talking about it in the teacher's lounge or in the cafeteria or whatever. And of course, testing is great now that testing is not free any longer. And testers are like $12.50 a piece. I mean, it's too expensive for people to regularly test unless their insurance covers.
Right.
That's some do, some don't. So what I put in my own answer, and this isn't very helpful, is if wastewater levels are rising in the community or COVID levels, absences in the school are rising, then it's time for a campaign for masks. And the other thing that occurs to me is, actually, it's a different question, but it's the next question. But let me put it together with this one: is how do we take care of kids who have asthma or the T1D? I don't know what that is.
Type 1 diabetes.
Oh, okay. That make their immune systems weaker. How do we protect them from transmission? And of course, it's the same as protecting anybody else. The problem there is if the tendency of the school or allies is to say, well, let those more vulnerable individuals mask, but not everybody else. That is a very questionable idea to me, because obviously it sets them apart. And you know how kids are. They could be targeted or bullied. And there's so much in certain communities of mask as a political symbol. If you wear a mask, people look at you cross-eyed in some communities. So having one group of kids told to wear a mask would be unfair. The other thing is all masks leak somewhat. I mean, maybe N95s worn perfectly, real world, no. But nobody in school is likely to wear an N95. I mean, they're expensive, they're hard to breathe through. So if you're wearing a good mask, like a KN94, a KN95 or a KF94, those are the best ones that are pretty breathable. There's always going to be some leakage. They're not perfect, and people don't wear them perfectly. Okay, so if one person is wearing a mask in a group, there's still lots of COVID in the air from combined leakage of everybody. If everybody's wearing a mask, there's very little COVID in the air, and you're protected from that from the mask. So it's much, much more effective to have everyone wearing them. And it should be understood too. We tend to think, because we wish, that if we have good HEPA filters in the room, that we don't need masks. But think of it this way. You're sitting next to someone and your faces are 2 feet apart, right? The HEPA unit is somewhere several feet away from you. And there's air coming towards you to the HEPA unit. But when you're talking to each other, you can be spreading particles to each other before those particles get to the HEPA unit. So a HEPA unit is not universal protection. It dilutes it in the whole, it takes it out of the whole room. But if there's someone in the room who's infected, they're producing it and may infect other people before it gets filtered. Granted, it will get filtered, so the concentration in the whole room and anybody's exposure is going to be way less than if there were no HEPA unit.
Right. And I think a thing that always gets lost in the conversation with when you're trying to get ventilation in the schools, or you're trying to get, the institutions, the doctor's offices to mask, is because there's always the argument that masking isn't perfect, but reducing viral load is really valuable. The more you can reduce the viral load, the less infection, the less it's going to spread. It still will probably spread, but I'm kind of the mind of any little bit that we can do helps. And that might be also, part of a strategy, as someone asked in the chat about their child wants to try to start advocating for ventilation in school, just reducing the infectious load that students and teachers are exposed to with ventilation is, you're probably going to be an effective argument to get them to see.
Well, the argument we always make is
return.
layers of protection, which is
Yeah.
ventilation, masking, distance,
Yes.
and limited time and with other people if possible. But in an area where you're all going to be together in school or any other workplace, masking and ventilation together is best.
Exactly.
And if you don't have masking, then a lot of distance between.
Mhm.
Like 6 feet is not an adequate number, because the 6 feet was created before it was recognized. Well, it was recognized in my community, the industrial hygiene community, but not in the public health community, which tends to have no industrial hygiene expertise, which is a shame. But they were only looking at big droplets that come out that are big enough to fall to the floor, and they tend to fall to the floor within 6 feet of the person.
Mhm.
But that's not a hard and fast rule. Some people sneeze hard, and they can, or there's air currents in the room, and they can go way further than 6 feet and fall. But the particles that we're more concerned about are the teensy ones that stay airborne. And if you have inadequate ventilation in the room and the particles are in there wandering around like cigarette smoke, it's
Yeah.
just sitting there, and it can be sitting there for an hour before it dissipates or gets dried out or whatever. Somebody, hang on. In your last year's when you said often rooms require more than one HEPA to get sick. That's right. Yeah, that's a technical point. But the thing is, if you have tiny particles in the room floating around within inadequate ventilation, then 6 feet is meaningless. The whole room is contaminated. With
Right.
good ventilation, that they're not hanging around, they're being ventilated out, and then 6 feet isn't really very meaningful, because what I said before, if you're 2 feet, if you're 6, I'm sorry, let me say, it's not very meaningful. You want to keep a certain distance, several feet from somebody, in case they breathe on you, someone who's infected breathes on you before the ventilation can get to it.
Right.
So I don't know what the figure should be. It probably should be less than 6 feet, because if you're sitting 2 feet away from somebody, I'm getting boggled up. Of course it should be.
And I love I always use
Speed
the
is kind of
cigarettes.
arbitrary, is all I'm saying. Go ahead.
And I always use the cigarette smoke analogy as well. And then sometimes I wonder if on younger people that's lost, because, they're not used to going to a restaurant that's full of cigarette smoke or flying on a plane full of cigarette smoke. But that's the one that sticks in my head.
It's easy to visualize, because
Yes.
if you've ever seen it, it
just hangs in the air.
It hangs in the air.
Yeah.
And so will any microscopic particles or aerosols will hang in the air, because they're too light to be affected by gravity.
And can linger long after the smoker has left the room.
Right.
Yeah. And the question they wanted to know, when Boston got the air purifiers for the rooms, were they able to get enough air purifiers to have the 6 air exchanges per hour? Do you know?
I'm not sure.
Okay.
I've never seen figures on that. I kind of am guessing that they did, because they wouldn't be citing it nationally as this big victory. I know where I live outside of Philly, I'm not sure how it happened, if it was the union or whatever, the teachers union, but Philly got HEPA air units for every classroom too, but they bought the cheapest ones they could find, which were, big enough for a teeny little room. So it's completely meaningless. They spent millions of dollars for nothing.
All right. So the last question I have was, poor air quality affects children's health and increases the risk of transmission of sickness. Is it possible to have indoor air quality regulated in schools? Do you think that's a possibility at some point in the future?
I don't think it's likely. For one, OSHA is the regulatory agency for health and safety.
Mhm.
They don't have an indoor air quality standard, and OSHA doesn't apply to the public sector, which includes public schools. So they're not covered by that. So usually any regulations are going to be local, what the school board puts out or the health department puts out. And to my knowledge, there might be some places like California has very good regulation, but most places aren't going to have it. The one thing that's hopeful to me is the professional association of HVAC people, which is called ASHRAE, and it stands for American Society of Heating, Refrigeration, and Air Conditioning Engineers.
Mhm.
And it's very highly thought of, and they have a lot of authority, and they put out, they're not laws, they're guidelines for all manner of HVAC conditions of buildings. But they have indoor air quality guidance, and just this summer they put out a revised guideline for air conditioning to protect from infectious particles, COVID and any other.
Wow.
Okay, this is new. They've never done this before, and it's because of COVID. And these folks are terrific. I mean, they're the best in the country. The thing is, ASHRAE guidelines very often get incorporated into building codes. And once they're in a building code, they're law. They're required of new buildings, not necessarily old ones. But at least they have the authority and credibility as the best guidelines around now. And so that standard, it's 241, I believe, is the number of it. You can't really get it. You have to buy it for a fortune, or you can go to your health department and see who has a copy of it, or OSHA or an engineering firm, and try to borrow one if you want. But I'm not recommending that people go and get 241, because reading an ASHRAE standard is very technical. They're very hard for me to read.
So to make sure, I want to see if I understand this. So now that that's part of their guidelines, does that mean that going forward with new builds that they will have to meet those standards?
If the municipality puts them in the building code, yes.
Okay.
But very often ASHRAE standards are in the building code.
Okay.
So
do you think there's any value to the argument that aside from airborne infections, that air quality in schools still impacts kids' ability to pay attention and to do well on test scores? Is there hard data and information on that could be be another tool, another source that we can use to advocate?
Yeah, there is some. If you look at the document that I wrote for PCDC, ventilation in schools, and that's referenced in the resource list.
Okay.
The introduction discusses that and gives a few references. There might be some more recent ones than those, and I haven't kept up with that. But that was only written a year and a half ago. So
okay.
It's fairly up to date.
Because I just wonder if that might maybe make some progress with in some districts, because it's more impacting test scores and attendance and things like that, and kind of making unfortunately the political COVID infectious discussion secondary. While it's our priority, it kind of just gives more of a apolitical stance to the argument, maybe.
Yeah,
so.
I would definitely look there at that and look at the references.
Okay.
Because that whole thing is referenced.
Okay. And we will share this. This is the info sheet that Fran put together for the People CEC. So we will be sure to share that through all of our social media channels as well. So Fran, thank you so much. This has been really helpful. We really appreciate you speaking to the community.
Okay, it's my pleasure. And did you want me to stay around for questions in the chat that haven't been answered, or are you gonna have?
I think we answered them. Yeah.
Oh, we did. Okay, I wasn't looking at the chat. Okay.
And Megan, you're on mute. I don't know if you wanted to like do the outgoing message.
Yes. So I just wanted to say thank you so much for doing this. That was really good information, very practical and like immediately applicable, and which is what we want. So thank you so much for that. Just so everybody knows, I figured out that someone may have tried to play a video game. I might be looking at them right now, which kicked me off the Wi-Fi, and then my little phone tried to help me. So I was on my phone's hotspot. So now that that's why it was lagging. Okay. So now that we've all figured that out, including the child who's quickly running up the stairs, we will figure it out tomorrow. We'll have better connection tomorrow. Tomorrow we have Awareness for Potsies, which is a nonprofit that focuses on POTS, and they're actually going to come talk to us about POTS in children. There's not a lot of research. So we have a pediatrician and a nurse practitioner who both are board members of this group, but they also have the condition themselves. And so they're going to come and talk to us about children specifically. You know, there just isn't a lot of research. There isn't a lot of doctors. There isn't a lot of information out there. So we're very thankful that they're coming, because what we see in most kids, I would say, with long COVID is that it's manifesting with nervous system issues like POTS. So we're very thankful for that. And then we have another caregiver panel, this time focused on parents and families' journeys of trying to get accommodations at schools. And they will talk more about the impact on cognition. And so really good. We're going to send out the one about the toddler to you all. And it will be a cleaner version, because hopefully you'll have better access to internet than I did today. All right, everybody. Thank you. And we'll see you back here same time tomorrow.
Yeah.
All right. All right. Thank you, everybody. Have a good night.